Most people are overpaying for health insurance because they don't know about federal subsidies. The truth is, subsidies exist for a much wider income range than most realize, and they can save you hundreds to thousands per year. But you have to know where to look. Today, I'm walking you through the exact process: understanding plan types, checking your subsidy eligibility, calculating real costs, and enrolling. By the end, you'll know how to find actually affordable coverage that fits your situation. There are three main plan types, each with different costs. PPO plans let you see any doctor without a referral, more flexibility, but higher premiums. HMO plans lock you into a network, lower your premiums, and reduce copays. HDHP plans have high deductibles but low premiums, plus an HSA, a tax-advantaged savings account you control. Which saves you money? That depends on how much healthcare you actually use. If you're healthy, HDHP wins. If you see doctors regularly, HMO is safer. PPO is the middle ground. Head to healthcare.gov and enter your expected 2026 household income. Here's what matters. Subsidy cutoffs are roughly 4 times federal poverty level. For a single person, that's around $58,000. For a family of 4, about $120,000. These numbers shift yearly. Be honest about your income estimate. If you're self-employed or between jobs, use your best guess. Healthcare.gov instantly calculates whether you qualify and how much you save monthly. Some people save $50, $100, even $300 per month. This is where people get trapped. They pick by premium alone. But actual cost is monthly premium plus your deductible, copays, and out-of-pocket maximum. A $150 plan sounds cheap until you hit a $7,000 deductible. Do this for every plan. Premium times 12 plus the out-of-pocket max you'd realistically hit in a year, usually $7,000 to $10,000. That's your true annual cost. Compare that across plans. A higher premium with a lower deductible often costs less total than a cheap plan with huge deductibles. Here's a solid guarantee under the Affordable Care Act. Preventive care has zero copay, zero deductible. This includes annual physicals, cancer screenings, vaccinations, and certain tests. True on every ACA plan, regardless of plan type or deductible. This is huge. Even if you pick a high deductible plan, your annual checkup is free. If you manage chronic conditions like diabetes, ask whether routine checkups count as preventive. Often, they do. That one benefit can save you hundreds annually. Normally, you enroll only during open enrollment, November through December for January coverage. But life events unlock special enrollment periods. That includes losing coverage, marriage, divorce, babies, moving states, or losing Medicaid. You typically have 60 days from the event to enroll. So if you missed open enrollment, check whether a recent life change qualifies you. This is how people get coverage mid-year without waiting until November. Don't leave money on the table because you thought you missed the window. Go to healthcare.gov, select your state, click Apply for Benefits. Enter name, Social Security, household size, and expected income. The system calculates your subsidy automatically. Then compare available plans. Filter by your doctors. Type in preferred providers to see who's in network. Read the out-of-pocket maximum carefully. Pick your plan, pay the first premium, and coverage starts on the 1st of next month. Entire process takes 30 to 45 minutes. Do it early. Don't wait until December when the site gets slow. 1. Don't assume you don't qualify without checking. Income limits are higher than you think. 2. Don't skip preventive care just because your deductible is high. It's completely free. 3. Don't ignore your out-of-pocket maximum. It's your safety net if major health events happen. 4. Don't wait until December. The window closes and you'll have uninsured months. Bonus: If your income changes during the year, update healthcare.gov immediately, and your subsidy adjusts. Avoid the surprise tax bill next April.